So we're going to find out how this works. Can you tell me the basics of MDX Hawaii and why this pop-up system is so beneficial?
Sure. MDX Hawaii, we're a network of healthcare providers. And what we noticed is that a lot of physicians didn't know when their patients are being admitted to the hospital, and most importantly, when they're being discharged from the hospital and they need to assume back the care. So we wanted to partner with a local company here in Hawaii called Elation Health. It's a cloud-based electronic medical record system that can let the computers at the hospital talk to the computers in the physician's office and do an instant message alert when the patients are discharged. So the doctor knows immediately, hey, I need to get my patient in to be seen. I need to find out what happened, make sure they understand what their treatment is, maybe the treatment's changed, and talk to them about their medications.
It sounds so basic, but so beneficial. Why is it so important to get them back in?
Yeah, it's really important for a couple of reasons. One, like I said, things might have changed. New diagnosis might have popped up, new conditions that they're going to have to treat, or changes to the treatments that they've already knew were implemented, new medications. Patients are at risk for having to go back in the hospital when they're discharged. We want to help prevent that. Studies have shown that if you're seen by your physician within 30 days, you decrease your risk of having to go back in the hospital by 10 times. So we want to allow our local physicians to know, let's get these patients in. If they're seen within 7 to 14 days after discharge, we decrease that risk of having to go back in significantly. And it also gives them a chance to look at the medications. These medications are confusing, and it allows the physician and the patient to really say, this is what I need to take, this is what I don't need to take.
And what have the results been? It's been early stages, but I know you have some promising numbers already.
We do. We were able to connect 90 physicians here in Hawaii to the system, and 90% of the physicians were actually able to see their patients within 7 to 14 days of discharge. Of the physicians that took advantage of this, they decreased the rate of having to go back in the hospital with their patients by 31.
Well, those numbers sound good. We are with one of the doctors in the office of Dr. Kurata. We're going to talk with him about how this is working for this patient. Thank you so much, doctor.
Thanks.
And we want to see how this works with physicians and patients. So, Dr. Kurata, can you explain, in your experience, how this new pop-up system is helping?
Well, I receive a reminder in my electronic medical record that a patient was just discharged. In fact, we try to follow up with the patient within 48 hours with a phone call to make sure that they're doing all right. When they do come in, we go ahead and review the hospital course, the medications, and any changes that have occurred. And we try to make sure that they get follow-up with maybe the rehab or other doctors. When we review the medications, we review their frequency, the dosing, and what the medications are for.
And everyone can use a reminder, certainly busy physicians and patients who've, been coming in and out of the hospital and getting their care and so forth. So what is that process like, the follow-ups?
Well, when they come in, we review what their medications were before the hospitalization and what they are now after the discharge. And so we review their medications, what they're for, the dosing, the frequency. And we find that 50% of the time, patients over 64 years of age don't even know why they're taking their medications or what they're for. And so we review that as well as the doses.
And without the system, was that just a more difficult process? So what has this really done to enhance the physician-patient?
In most cases, we don't even know that they're discharged from the hospital, and so they don't even come in to visit us. So we lose that opportunity, and then they might get readmitted.
All right, so MDX Hawaii, new pop-up system, helping patients and physicians, making sure that everyone's health is on track. Thanks so much for having us out and explaining how it works for you.
Thank you.
Okay, it's making things a lot easier for everybody. Who would have thought that simple messaging would make things better?